Good afternoon, and thank you for taking time to tune in to Calhoun County's COVID update, our live press conference that we have this week to give you the latest information on COVID in Calhoun County. Unfortunately, again, it's not a good update. For the last several weeks, it's been tough to stand here and be able to convey what's truly happening in our county. The situation continues to be tough as it relates to COVID. When we look at total cumulative cases, right now we're at 1,807 positive cases that have been over time in this county. 674 new positive cases have occurred in the last 14 days. This still remains our highest, or our second highest 2-week period to date so far. The only good news that we have today is that there's been 267 cases in the last 7 days. This is an improvement and the best numbers in the last 3 weeks. That allowed us to drop from the very high risk category, according to Alabama Department of Public Health, down to the high category. It's a good sign in the battle, but the war is far from over. So it's important for each of us to continue to be aware of this and to practice these important precautions that we'll talk about today. Unfortunately, when we talk about fatalities that have occurred as a result of COVID, we clearly know now that COVID is a killer in Calhoun County. Since last week at this time, we are aware of 9 additional deaths. Actually, since these notes were written, 10 additional deaths that have occurred since this time last week. This brings our confirmed deaths to 17, and it brings our known total deaths, total fatalities due to COVID-19 to 30 in Calhoun County. When we look at the breakdown among cases throughout the county, we talked last week about our long-term care facilities. There's a couple of those that are being adversely impacted by COVID within their facilities among residents and staff. When we look at the numbers, it appears that it breaks down to about 20% of Calhoun County's cases over the last week can be attributed to our long-term care facilities in the county. The Unified Command continues to offer assistance to these long-term care facilities, and the Alabama Department of Public Health's Healthcare Standards Bureau is working with these facilities to do all they can to help improve the conditions there and to be able to eradicate COVID from these facilities. At this time, I'm going to turn it over to the hospital officials, and they'll give the update of what it looks like in the hospital today. Lewis?
Thank you, Michael. Pull my notes out here. So I'm going to give you all the numbers, and then we've got the physicians here that can talk through a lot of the details of some of the things that are going on. But currently in the hospital, we have 46 COVID positive patients spread across our 3 units. We have 10 of those patients that are ICU level, and 9 of those are currently vented. As Michael shared, we have had here at the hospital, we've had 9 deaths over the last week. Last week we had 32 admissions for the week. So far since January the 1st, we're now at 156. So tremendous growth there. Our high last week, we had on Tuesday and Wednesday, we had 55 and 58 patients in the house on the units. So being able to drop down to 46 over the weekend, and it's held at 44 to 46 throughout the entire weekend, which is good news for us. So far, a couple of other quick things. We continue to work very hard as an organization to add additional staff members, both through working with our partners at Vizient, working through ADPH and the EMA. We have had some success there in adding additional ICU nurses and additional med-surg nurses over the last several weeks. One thing we have had to do as a result of the need for more nurses and the increased census is we have had to place some restrictions on overnight surgeries. I believe we mentioned that in a previous conference, but those restrictions that we've had to place on those surgeries will continue. We're very hopeful that we can lighten that restriction, hopefully by sometime later in the next week or so. But in order to do that, we have to see the virus and the number of patients in the hospital continue to drop in order for us to make that decision. So, Joe?
Good afternoon. From a Stringfellow standpoint, I would like to say that during the early part of the weekend, we did see a bit of a decrease in our ICU census. However, we're already back to pretty much full capacity as we continue to take critically ill patients from the emergency room, both here at the main campus and ER patients through our ER at Stringfellow. And we're also continuing to offload medical patients from here at the main campus. What's concerning about this is that it's only Monday, and we now have a physician's offices in town back open. And what that means is that they'll, in addition to these ICU patients or ER patients, we will start to see direct admits from those physician's offices. I think that we mentioned before, this is not so much a bed issue, it is a staffing issue. We have also been able to secure several travel nurses that will be starting at our facility over the next few days, and they'll help tremendously. But our greatest ally through this ordeal is going to be slowing the spread of this virus. You heard Lewis mention that the main campus has taken on additional staffing as well, but the problem is that we have so much of our existing staff spread across 3 units, and we just don't have a lot of resources to back them up. The number of non-COVID patients in the market is not decreasing, so that's continuing to place a strain on our systems. I know that we've heard someone say already that the numbers are somewhat encouraging, but I would say that we should certainly not allow our guard to be let down. We do have another major holiday coming up, and we can't afford a repeat of what happened during the 4th of July holiday and beyond that. So again, please make sure that you wear your mask, wash your hands as often as you possibly can, and maintain as much social distancing as you can as well. With that, I'll turn it over to Dr. Free.
Have notes too. I'm Dr. Mimi Free. I'm Chief of Staff here at Regional Medical Center. I wear my mask all the time, you see. And I'm just going to give a few tips on what you should do to keep you and your family safe. Again, like Joe said, and we're all saying, wash your hands. Wash your hands with soap and water or with a 60% alcohol-based sanitizer. Wash your hands for at least 20 seconds. For children, that's doing the ABC song. ABC, I won't go all the way through it, but that would be helpful. Self-isolate. If you or your family feel that you're coming down with this illness, if you're feeling febrile or have a fever, you have a cough, congestion, you feel extremely weak, you're chilling, you're sweating, you've got a loss of taste and a loss of smell. If you feel extremely weak, please call your primary care provider, nurse practitioners, call the urgent cares, call a medical facility to get some assistance immediately. When you talk to your family, you should talk about what their wishes are. Should they be admitted to the hospital if something goes wrong and they have to be admitted? You need to find out from them what they want specifically. And in talking about that, if they have to come to the hospital, we need to know what their advance directives are. And I would normally not say this to usual people coming into the hospital, but we have seen, I kid you not, young people come around the bend of the ER, breathing on nasal oxygen. In 10 minutes, they're on a ventilator. In 2 to 3 days, they're dead. So you need to find out from your family members how aggressive you want us to be and how aggressive you want to be. Do not wait for the symptoms to get worse, because we don't know how this virus reacts with everybody. When your virus attacks you and your body attacks the virus, there's a huge reaction that occurs called a cytokine storm, or just the inflammatory response of your body. When that happens, we don't know how that's going to react. We don't know how you're going to react. So please do not wait. Other things that I want to say for going out. If you're going to go out to the grocery store, you're going out to pick up things, have everything succinct. Get a detailed list written out so that you don't have to tarry and spend a long time out in the public. If you've got loved ones at home, people that are sick in your community, people that are shut in, get lists from them. Go and pick up their medications, pick up their groceries for them. Be careful when you go back to them, because you may be an asymptomatic carrier, meaning that you may have the virus yourself. Always wear a mask. Love yourself and love your people around you. If you have to come into the hospital, again, like I was saying, let us know what you need. If your wishes are to be do not resuscitate, we need to know that immediately. We need to know who your point of contact person is. It's very difficult when we're taking care of patients and we have, many phone calls coming in and we're diligently trying to take care of folks. It's very difficult trying to answer the phone to different people. Have a point of contact person for each family. And then you have to have a PIN number in order to get information on that family. So you've got to know that. We need to know if you're going to be, full code, DNR, what your wishes are. If you do get admitted, or if you have to go to an urgent care, if you have to go to an emergency room, have your information about what you need to be done at home taken care of. If you've got pets at home, young children, if you've got bills to pay, if you've got, things that you've got to take care of, have somebody that's going to be there for you to help you with that. Because, again, we don't know how long you're going to stay. It may be a small time, it may be long, weeks and weeks. We just don't know. Please just remember that when you come into the hospital or any urgent care, any place, have an updated, accurate medication list with your allergies. Please, please, I can't tell you how important that is. If it's during the day, we can call the pharmacies. If it's at nighttime, we don't know. We're just going by what you have or what you may have had in the hospital, and sometimes that information is not correct. Please also have what your disease processes are. If you are a cancer survivor, if you have had transplants, if you're on chemotherapy, if you have HIV, if you have autoimmune diseases like lupus or anything like that, you're most vulnerable. If you have diabetes, heart disease, you have COPD, these things are very, very important to let us know what may happen if you should demise from this disease. You've got to stay safe. You've got to stay diligent, vigilant. You've got to wear your masks. You've got to self-distance. Please, we cannot tell you enough. This disease has no respect of persons. Anybody can get sick. It doesn't care where you're coming from. Anybody can get sick, and anybody can die, and we are seeing people die from this. Thank you.
Good afternoon. I'm Dr. Magadi. I'm infectious disease. I'm one of the lead clinicians at the COVID ward. I want to talk about two things that I already kind of briefly mentioned the last two briefings. One is asymptomatic carrier. I talked about the South Korean literature that suggests that about 42% of people who have COVID might not have symptoms. We don't know up until last week how infectious they are, and there was a paper that came out a week ago from University of Reading in UK that suggests that those people with no symptoms with COVID might have the same amount of virus like the ones with disease. So it's just a matter of, those people with symptoms, they cough, they sneeze, and that's the reason why they're infectious in nature. But those people with no symptoms, they have the same amount, same density of virus in their mouth or their throat. So it's equally dangerous for you to be exposed to people with or without symptoms. The second one that I want to talk about is the medicine that we're giving here in the hospital called remdesivir. It's an antiviral medicine that got available to us sometime in June, maybe late part of May. And so far, we have given remdesivir to 25 patients. You're wondering, we've had almost 200 patients now. Why not giving that to everybody? It's not really for everybody. We have certain criteria that we give this remdesivir on. There's certain disease entities, comorbid conditions that we cannot give this, especially those with kidney problems. There's also some parameters like oxygen levels that we specifically give this to them. Of the 25 patients, 5 of them were discharged, either home or nursing home. Unfortunately, 6 of them died. I know each one of them, all 6 of them, I know them by name. So although it's promising, it's not really a home run. So it's about 24% of the 25 patients that we have given remdesivir on, unfortunately died. 14 of those patients that we have given remdesivir, they're still here in the hospital, and 5 of those 14 are still actively giving. So that being said, we have some medicine to give. those people with severe infection. But the most important thing, and we cannot really overemphasize this enough, 3 things that will make you not come to the hospital: social distancing, wearing your mask, and vigorous hand hygiene. I'm gonna say that over and over again, but that's really something that you really have to remember. Thank you.
Thank you, doctors. So for weeks now, or even months, we've stood before the public, before the media, before our unified command, and talked about numbers, statistics, in a generic way. And we can do that. We can continue to do that. But a lot of times we see in disaster that people don't really take it as serious unless it truly affects them. And so today, joining us, we have a few members of our unified command, partners of our unified command that are actually survivors of COVID-19. And they're going to come share with us now some of their experiences in contracting the disease and the effects that it's had on them and their families to date. So first we'll have Johnny Phelps, he's a captain with Anniston Fire Department, to come. After that, Ruth Moffett, the director of 211. And then following up will be Dr. William Bohannon with RNC Occupational Health. So Captain Phelps.
Hey, as he said, my name's Johnny Phelps. I work for Anniston Fire Department, and I got sick on July 24th on a Friday and tested positive on Saturday morning. Spent the next 4 or 5 days with headaches, cold sweats, fever, fatigue. Ended up losing 20 pounds over the next 5 or 6 days. 43 years old. I don't have any real medical history at all, so I feel like I'm in halfway decent shape. I have to be for my job. And it knocked me down pretty good. I know I was exhausted for the next several days after that. And even though the symptoms seem mild to a lot of people that are being put in the hospital, and I feel like I'm really lucky and blessed for that, it hit me a lot harder than I thought it ever could, honestly. My family, of course, they were quarantined. My wife's out of work for 14 days. Couldn't touch my son for 10 days nearly. So it was not a nothing type of event. It wasn't a normal flu type of event. And so that's coming from somebody that is real, is younger, and works in public safety business. So I have to be around this stuff no matter what. It doesn't matter. So that's the real story of it. It's not a joke. And I hope everyone takes it serious enough to not feel like they're immune. Thank you.
So my name is Ruth Moffett, and I'm still a little nervous about not having my mask on when people are around, just because of what me and my family have gone through. So around July the 5th, my son, well actually it was July the 4th, my son came in. He had a upset stomach. He came in, he said, I think I ate something that didn't agree with me. Stomach was upset, but nothing else was bothering him. I didn't think very much about it. I thought he's an adult, so I just thought it was something that he ate. The next morning, I said, hey, are you feeling better? He said, oh, I'll be okay. It's just, I think I just got a little stomach bug or something like that. And so I was like, okay. So by the next day, I started coughing. My husband started coughing. I had a little post-nasal drip. But, I thought it was my allergies. My husband and I both suffer from allergies. I see an ENT, so I thought, well, it's allergies. So I started taking my allergy medicine. By that night, my son decided to go to the ER. He was tested, and he tested positive. And we were just shocked because other family members had been around, and so we knew what that meant. So my husband and I, that next day, went right ahead and we got tested. Both of us tested positive. My husband has pre-existing condition. He's borderline diabetic. He has bad high blood pressure. I don't have any pre-existing conditions, and we both, contracted it at the same time from my son. But fast forward, I do want to say this because I have 11 family members tested positive in all, because we all thought it was a stomach ache. It was just a stomach bug. And maybe he had some fever and just didn't realize it. I really don't know. I just know that 11 of us ended up with it. A grandchild that's 2, a grandchild that's 7, and then some adults and some other children. And I'm saying that because from the ages of 2 to the ages of 50 something, we were all affected. And thank God none of us ended up in the hospital, but we were all down for a minute. And I want to say this virus is, it's horrible. We were, of course, like I said, we had the postnasal drip, we had the headache, we had the cough. My husband had really, really bad cramps. It takes your appetite, so you're trying to keep something in your system. You're trying to stay hydrated. You're having the chills. We had really bad sweats. My granddaughter had the shakes. She would hold her hands out and they would literally shake. And we were just praying that she would come through it and would not end up she actually had to go to the hospital because we wanted to make sure that, nothing bad, we had read about these storms that occur in your body. And so my daughter took her to the ER. They said she was okay. She came back home. But it takes a toll on your body. You feel horrible. And so I'll say this, wear your mask, use the sanitizer. We use sanitizer around our office. We use sanitizer in our home. As a matter of fact, I use so much sanitizer, it's a wonder I haven't OD'd in my pores. And yet I caught it. And so you just got to, but you still got to do those things. We let our guard down because it was my son and it seemed like a stomach ache. No symptom is too small. Take every symptom seriously. And now I'm like, I used to be borderline germaphobe. I'm full-fledged now. But it leaves you fatigued. And I was sharing with someone before this virus, and I can see that I'm getting better, but before this virus, I could multitask. I could send an email and do a phone call, and I knew the order of what I wanted to do things. It's not like that for me now, and I wasn't hospitalized with it, but I still can feel some effects in my body. I still sometimes have the tightness in my chest, where I have to do warm drinks or I'll put something warm on my chest. During the time that I was positive, I would put tiles in the microwave, lay one on my back and one on my chest, just trying to be able to get something up. And then the last thing I want to say is the fear that goes along with it. I think a lot of people that have experienced it, I know for us, I had a lot of anxiety. I was concerned about all of our family members. We did go back and retest because I had to have a negative test to go to work. My husband retested negative before I did. He retested negative, and so then I thought I need to do what he was doing, which was a whole bunch of vitamins. So I started doing a whole bunch of vitamins, vitamin C. I increased those things, and I'm continuing to do those things to try to fortify my immune system. But please take all these cautions seriously. My greatest fear through the whole thing was that because we became comfortable at home, that one of our family members would not survive it. And that didn't happen. We did survive it. And so, again, don't take any symptom lightly. The only known symptom that I know of that my son had was an upset stomach. He didn't have anything else. So don't take any symptom lightly. And when you go out, wear your mask. I even want to say this. We would order our groceries and go pick them up. So we were practicing some safe things, but sometimes we can let our guard down with our family members and think that it's something, and not think that it could possibly, we look at everybody else as maybe that person, but it could be that family member and we just overlook it. So be safe, wear your mask, use your sanitizer, follow these precautions so that you can continue to enjoy your family. I'm thankful to be able to continue to enjoy my family, to be able to work my job. And I'm telling you, I'm counting life as a blessing these days. Thank you.
Hello, I'm Dr. William Bohannon, and I guess I'm one of the earlier folks to actually catch the virus. I went to work on May 11th, did not feel bad. By the afternoon of May 11th, I started feeling a little tired and thought I had a mild fever. My program director insisted I get tested on May 12th, and I tested positive for COVID-19 on May 12th. The thing that surprised me the most about the condition was just how rapidly I felt horrible. I went from one day feeling pretty good. After another couple days, it was just bone-weary exhaustion. I had the fevers, I had the chills, not so much the body aches, pretty significant bronchitis, hurt a lot when I coughed. Luckily, my coworkers were somewhat paranoid, so they made sure I checked my O2 sats regularly. Started taking the zinc and the vitamin C right off the bat. The fevers broke after about 5 to 7 days. The fatigue lingered for almost 2 weeks. I'm over 50, but I don't really have any other chronic medical problems, and it truly, truly hit me hard. One of my biggest concerns was family members, because once they found out I was COVID-19 positive, they had to come over and check on me. And it was a difficult issue of stay away, make sure you stay at least 6 feet away, wear the masks. I'd wash my hands before I'd go down. I had good family support. Everyone was dropping off items. I didn't have to go shopping. But the things that really struck home with me are everything went very quickly, and I felt really, really bad. But luckily, I was able to get over it. But that was kind of my experience. All right. Thank you.
Thank you, Dr. Bohannon and Ruth and Johnny, for being willing to share with us and with the community about your experience with it, and it's no joke. These are survivors that we've heard from today. Unfortunately, as we talked about earlier, there's at least 30 people in this county that can't stand here today because they passed away due to COVID-19. One of those being the chairman of our county commission, Eli Henderson, that passed away just this past Friday. Before, typically him as chairman, before I would come up and do this briefing, I would talk to him sometime in the day, and he would always be encouraging to keep doing what we're doing. Very supportive of the unified command in these efforts. Today, he can't stand here before us and encourage us in that. But yesterday, I was encouraged by his widow, by Miss Carolyn, as at the funeral, as she hugged me and said, "Michael, keep telling people what this can do to individuals. Keep telling people what it can do to families." And so we stand here today as a unified command, as a county, and we continue that. We continue to tell that story, to raise awareness of it, to give you tools, precautions that you can take, so that hopefully you can do everything, we can do everything we can to protect ourselves and protect others to make Calhoun County as safe as possible. At this time, we'll open it up to our Facebook and social media audience, as well as the media that we have present today for any questions that you may have from any of our speakers.
Michael, I'd like to join in you in giving a special thank you to the survivors who shared their story today. I have a question for any one of them who want to answer it. Do y'all have any continuing lingering effects? I've heard that often happens with COVID-19 survivors.
So for me, it continues to be some of that chest tightness. It almost feels like bronchitis, like I can't get my chest to open up. And that's not all the time. What was interesting about this, and I think I've shared this, is that you will wake up in the morning and you'll feel like, okay, today is going to be good. And then in about 2 hours, it's like, nah, it's not going to be so good today. Because either you're really fatigued, you're tired, or you have like that chest tightness. I had that chest tightness just about all day yesterday. But what I generally do is go get me a hot cup of tea, and I drink that, and then I do, these doctors, I hope they say I'm not doing wrong, but 1,000 milligrams of vitamin C twice a day to try to boost my immune system. But one of the things that, another thing too, that may not seem like much is what I talked about a minute ago, which is I have to think about what I'm doing. I used to easily be able to multitask and check multiple things and things like that. I noticed that most at the office, where I used to be able to just do it. Now I have to think about what I'm doing. And I wasn't like that before. I multitask and I can do a couple of things, and I'm just accustomed, that's how I do. And so now I notice that difference, and I notice that I tire more easily. So those things that I've noticed since I've had it. Now my husband occasionally, and he had pre-existing conditions, he's kind of having the same thing, where he has that chest tightness every now and then. We thought at one point he was going to have to go in the hospital because he had a pretty significant cough. But we started doing Robitussin. We were doing Mucinex. We started doing Robitussin. We switched to Mucinex, and we were doing those hot towels. So he was able to get that stuff up and get it out. So.
When did you have the virus? When did you first get
July. I believe that we were actually we actually got it like July the 3rd, and by July the 5th, or no, it wasn't July the 5th. It had to have been before that. We were diagnosed July the 5th. My son was diagnosed July the 5th. We were diagnosed July the 6th. Yeah.
I have a question for Dr. Magadia. What is your recommendation for zinc and vitamin C?
So early on during the pandemic, early part of March, April, we have been advising this regimen of vitamin C and zinc based on not really on the COVID pandemic, but based on septic shock. So what we typically do in the hospital is high dose vitamin C, and we give 2 grams every 8 hours. So it's a 6-gram IV dose, which we do not recommend that you guys do. The highest possible dose that you could get, that you could take by mouth, is 4 grams, beyond which it's essentially useless because there's a receptor in your gut that transport that vitamin C into your circulation, and also there's a risk of kidney stones. So we only recommend giving vitamin C or taking vitamin C at least maximum of 2 grams a day. So that's 1 gram in the morning, 1 gram at night. Personally, I take 1 gram a day. If I'm feeling kind of under the weather, I take 2 of those. The zinc, it depends on what zinc. If it's zinc sulfate, it's 220 milligrams twice a day. If it's zinc gluconate, it's 550 milligrams twice a day.
One more question. How many days after your symptoms go away before you should return to work or be out in public?
So the recent CDC guidelines that was published on the 17th of July suggests that after 10 days, if you don't have any underlying immune condition like bad diabetes, cancer, HIV, you could be back to work after 10 days without having a repeat testing done. If you happen to be hospitalized and have severe COVID-19 and or you have immune conditions, bad diabetes, HIV, the cutoff is 21 days. So it's 10 days for most people, mild to moderate symptoms and no underlying condition, and 20 to 21 days in people who have been hospitalized with immune system problems.
Any further questions? Very good. Thank you for your attention today. Thank you for being a part of and being involved in Calhoun County's Unified Command. Everybody has a part to play, and it's important for each of us to know what those precautions are, to practice those, to keep everybody safe. Important way to do that is keep it updated. We encourage you to do that through the Calhoun EMA website at calhounema.org or through our social media platforms of Facebook, Instagram, and Twitter. And also, as always, if we can help any, you can feel free to give us a call at 256-435-050, or Ruth and her folks are always available at 211 to help the community in any way possible. Thanks, and stay safe.